Hello, my name is Brooke Lappe, and I'm with the Rollins School of Public Health. And today I will be discussing our paper recently published in the American Journal of Public Health titled Social Vulnerability in the U.S. Communities Affected by Wildfire Smoke from 2011 to 2021. Briefly, I'll be covering an introduction and rationale of our study, our methods, results, limitations, conclusions, and some acknowledgments. So, in the recent years, the extent of wildfires has more than doubled compared to previous decades, with 2021 witnessing 7.1 million acres burned compared to 3.3 million acres burned in the 1990s. The resulting wildfire smoke contains hazardous pollutants that compromise air quality and contribute to respiratory diseases and mortality. As climate-related factors heighten the risk of wildfires, exposure to smoke is projected to rise, affecting even distant and unprepared communities. Since wildfire smoke can travel vast distances and exposes populations to health risks, there are communities that are particularly less equipped to handle it than others. The distribution of smoke can lead to similar exposures among neighboring communities, but susceptibility and adaptability vary, influencing potential health disparities. Such disparities, those seen with extreme heat, can be attributed to social and community characteristics. So this study aims to describe wildfire smoke exposure in the United States from 2011 to 2021 and determines its overlap with social and community characteristics that may affect adaptive capacity and, as a result, health. So we used community level exposure to wildfire smoke using the National Oceanic and Atmospheric Administration Hazard Mapping System smoke product, coupling that with the US Census and CDC Social Vulnerability Index data on populations. Plume densities were reported in the hazard mapping system as light, medium, and heavy. We did descriptive analysis on the presence of wildfire smoke plumes and their overlap with population centers to describe the magnitude and trends in wildfire smoke. Throughout the study, we used person days to capture together the number of people and the amount of time spent under smoke plumes. This measure can be adapted to consider communities of concern. For example, in our study, we use it to capture social vulnerability index communities. A person day is a useful metric specifically because it incorporates people into descriptions of air quality. So getting into our results, we find that over the study period, heavy smoke is becoming a more common and frequent hazard. For person days of heavy density smoke, the 5-year annual average increased 350% for heavy smoke. The increases for light and medium density smoke also increased by 39% and 71%, respectively. When looking at the first and last 5 years of the study period, we also found that 78.6% of the US population experienced significant decreases in the number of smoke-free days. Similarly, 72% of the population experienced increases in the number of light smoke days, 75% experienced increases in the number of medium smoke days, and 87% of the population experienced increase in the number of heavy smoke days. When we map smoke and disadvantage using the CDC's overall vulnerability score, we see that communities with fewer opportunities for healthy lives and fewer economic resources are experiencing dramatic increases in wildfire smoke. Census tracts in the highest SVI tertile, according to the overall SVI score. These tracts are representing the greatest health disadvantage for living healthy lives, experienced a 358% increase in the average annual number of heavy smoke days when comparing the first and the last 5 years of the study period. Locations with the greatest health disadvantages experienced similar increases in heavy smoke when you break down the overall vulnerability index into socioeconomic status, which experienced 346% increase in heavy smoke. The minority status and language theme experienced 449% increase in heavy smoke. The household composition and disability experienced 309% increase in heavy smoke. And finally, housing and transportation theme experienced 357% increase in heavy smoke. And you can see these areas that coincide with the highest smoke and the highest disadvantage are concentrated in the West, but also extend all the way to the Midwest. We looked at increase in person or household days of smoke by these individual social vulnerability index indicators. And we found that indicators included in the race, ethnicity, language theme had the highest increases in heavy smoke, where minority person days in persons with limited English actually accounted for the largest increases in heavy smoke. Notable increases were also seen for household and transportation indicators, such as crowded households and multifamily housing. There are several limitations to our analysis. One is that the social vulnerability index values are representative of a community rather than any one individual in that community. So they may misclassify individuals who are represented by an SVI ranking that is not indicative of their personal social advantages. The other limitation is that HMS data cannot differentiate plumes of differing heights in the atmosphere, and thus a plume may be over a census tract with minimal impact on ground level air quality. In conclusion, we find that communities with fewer opportunities for healthy lives and fewer economic resources are experiencing dramatic increases in wildfire smoke. These populations of concern are more likely to experience disruptions from smoke for reasons that include legacies of racial discrimination and economic exclusion. Our findings indicate opportunities to target emergency preparedness, recovery support, and interventions to address health disparities and poor health outcomes in the face of increasing wildfire smoke exposure. And I would love to thank my co-authors for their contributions on this work at the Federal Reserve Bank of San Francisco, University of California, Davis, and the Centers for Disease Control and Prevention. Thank you so much for this opportunity. And that is all.